What does Lyme disease do to your body? What are the symptoms? What's happening? That's what we're going to cover in this video. Hello everyone, Dr. Jason West with part of the Lyme series, and what this series is designed to do is to give you information, because I have found that patients that have all of the information in front of them make good clinical decisions. They have a tendency to make the right treatment choices. They can take control of their health and they can get life back. Now, does that always mean that you're going to get cured? It doesn't necessarily mean that, but does it make it so that patients improve? I absolutely believe that the more information and education that you have about Lyme disease, the better you are equipped to not only have a better quality of life, but to make sure that you're informed and educated consumer. So let's recap about Lyme. We've talked about testing, we've talked about treatments, we've talked about transmission, and now we're going to talk about what does Lyme do. Well, the biggest thing that Lyme does is it just has a tendency to not make you feel good on multiple levels. And we're going to go through about 13 classic presentations for people that have chronic infection related to Lyme. And just a reminder, Lyme disease is a lonely condition. What I mean by that is it's so overwhelming when someone has initially told that they have Lyme. They go out on the internet, they find a bunch of good information, they find a bunch of misinformation, sometimes they find bad information. And when it talks about what to do about Lyme, here's what I tell people. You know your body better than doctors. You are not your diagnosis. I believe that there's always hope. If you put all of the building blocks back in place, I think you have a wonderful opportunity and wonderful patient outcomes. It's not a death sentence. There's some really good patient outcomes out on the internet. Unfortunately, there's some really bad and sad stories, but I don't believe that your diagnosis. And let's talk about what Lyme does. And I just like to read you this. Lyme is the 5th most reported notifiable disease in the United States, with an estimated of 300,000 to 1 million cases per year. I believe it's the fastest growing infectious disease because we finally know what we're looking for, and we recognize that it's a problem and it's not just some mythical condition. It's not psychosomatic. Now, it's so important to identify where you are on the Lyme disease pathway, because the faster that you can get treatment, in my experience, the better outcomes that you have quickly. It doesn't mean that you're going to have no symptoms in the future, but the faster that you can get on this disease, usually the better outcomes that you can get. So let's talk about what Lyme does. Now, one of the most common things that we see in Lyme is rashes. About 30% of people develop some type of chronic skin problem. The initial presentation of Lyme is you get bit by a tick, and then sometimes people get a bullseye rash, although 60 to 70% of people don't get the rash and they don't remember get bit by a tick. But we see a lot of chronic skin problems. There can be pseudo-psoriasis, which means it's not quite psoriasis. You get hives, you get urticaria, you get these little white bumps on the skin, you can get these little red markers. Sometimes people come in and they'll say they have Morgellons disease, which we're going to talk about in an upcoming video, but there's a lot of skin problems associated with Lyme disease. Another big factor that we see in Lyme disease is fatigue. And you know, usually you see kids running around the office or running around the playground or school. It seems like they have an endless supply of energy. And kids that have been exposed to Lyme or have a tick bite or suspect to have Lyme, usually they're very lethargic. They estimate up to 84% of children have chronic fatigue issues. So that doesn't say that kids that are tired mean that they have Lyme disease. If your child is lethargic more than normal, and you just have to listen to your parents' intuition, we want to make sure that we rule out Lyme disease. Achy joints are a huge problem with Lyme disease. It's recognized in the medical literature, whether you're treating Lyme all the time or if you're just learning about Lyme. We recognize that it likes to get into the joints, and I think that there's a smorgasbord of nutritional things that Lyme disease like, and so that infection goes into the joints, and it can be as high as 80% of people with untreated Lyme have chronic joint problems. I also think that Lyme, it can be possible that it can mimic or trigger rheumatoid arthritis, where your body has this inflammatory condition against the joint tissues. It can be a huge factor in other arthritides, which is how we describe multiple joint conditions. The problem with joint arthritis is sometimes over-the-counter or prescribed anti-inflammatories can mask and even accelerate the joint damage that's occurring with Lyme disease. Headaches, dizziness, brain neurologic, brain fog are all common presentations of Lyme. I think what happens is not only the Lyme can get into those nervous tissues or nerve tissues, but what happens is it has a tendency to deplete the nutritional building blocks that our body needs to protect the tissue. I think that Lyme can get in and around the nerves. The body tries to wall off the infection. And what happens is we get these little capsules that sometimes can be termed as white lesions. That's right, I believe that in some instances, white lesions are actually walled off compartments of Lyme disease, and as the nerve transmission goes and hits those compartments, what happens is it short circuits, and then you can be diagnosed with multiple sclerosis. Now, this is not the accepted medical reason for white lesions. This is just what I've seen in practice and my hypothesis. Lyme disease has a tendency to really disrupt sleep patterns, and whether it's the bacteria getting into the pineal gland and throwing off your melatonin levels, or maybe it's a neurological affecting your neurotransmitters, but I see this as one of the most classic presentation of Lyme disease. It alters your sleep patterns. It's hard to get to sleep and it's hard to stay asleep. The literature is showing that about 41% of people that have chronic Lyme disease have disturbed sleep patterns. Another common presentation of Lyme, or what Lyme does, is it causes a lot of brain fog and cognitive decline, a lack of mental concentration, a lack of mental stamina, being forgetful. And of course, there's a lot of things that can cause those conditions, but I see that frequently in people that have chronic Lyme disease. Another classic presentation of Lyme disease is light sensitivity. And when I see people from out of town, that they're from Missouri or Virginia or New York or Wisconsin, they come into the office and they have sunglasses on, it's one of the aha moments. And when they start telling me about all their healthcare conditions, Lyme disease really changes your photosensitivity and causes a lot of visual disturbances. And a lot of the times that people are diagnosed with multiple sclerosis with having the optic neuritis, I often wonder if it's Lyme disease bothering that optic nerve. Neurologic symptoms are common with chronic Lyme. It causes gait disturbances, it causes balance issues. I've had people walk down the office literally bouncing off the walls. They need ambulatory assisting devices. They'll need a cane or they'll need a walker because they just can't orient to the surface because I think the Lyme gets in and disrupts their nerves. Not quite as common as the other conditions, but there's a lot of heart problems associated with the Lyme. We call it Lyme carditis, or inflammation of the heart. And so it's not as high as some of the other conditions. About 4 to 10% of people that have Lyme disease have heart involvement. And so if you have a normal EKG or you have pain in your heart, atrial fibrillation, it may be triggered by Lyme. It's not as common. It's probably other things associated with it. But if you're having all the symptoms of a tick exposure, rashes, fatigue, joint problems, and then you have some cardiac problems, it may be Lyme related. Another common presentation of Lyme is how it affects your moods and your emotions. Now, when you don't feel good, it's easier to be depressed or have hyperirritability or anxiety because when your body doesn't feel very good, guess what? It bothers your mind, your moods, and emotions. Are you sick because you don't feel good, or because you don't feel good, are you sick? I mean, that sword cuts both ways. But see a lot of changes, personality changes in chronic Lyme. See people that used to be fairly even keel and now little things bother them. And can it be other things? Of course it can. And that's why you've got to put the whole Lyme disease spectrum into a puzzle and start putting the pieces together, because not everybody that has anxiety has Lyme, but it can certainly be an aggravating factor. Another thing that I see in Lyme is a regression of social and interaction with people. People that have Lyme disease have a tendency to be hyper-irritable and have some cyclic mood disorders because the chronic infection really likes to go after the nerve tissue. Now, these are just some of the conditions associated with chronic Lyme. If you have anxiety, if you have joint problems, if you have conditions, does it mean that you have Lyme? No, it doesn't. Can Lyme cause those conditions? It can. And that's why it's so important to understand that the testing processes that we did on an earlier video, you are not your diagnosis. I believe that there's always hope. If you're having a myriad of healthcare conditions, I think it's really important to rule in or rule out Lyme disease. This is Dr. Jason West, and I'll see you on the next video.